I want to welcome everyone to Fit as a Fiddle. It's all about health and wellness. I am Kathy Benner. I'm a passive income mentor. And way back in the day, when I first started this, I came out of the salon industry. And when I started this particular podcast, I thought, you know what, this just doesn't go with passive income. So maybe I should drop the whole health thing. And I had a girlfriend at the time. She said, don't you dare, because she said everything starts with your health. And I read something the other day and it really resonated with me. And it said, we all have lots of problems until we lose our health, and then we only have one.
Mm,
Oh, that's good.
yeah, true.
And I thought, I'm glad I didn't drop this lane. So health definitely comes before wealth.
Mhm.
And I kept this lane, and this is probably one of my fastest growing lanes now in the academy is the whole health and wellness. And I just recently went on a huge health quest for those that either know me or don't know me. And over this past year, it's just now been a year, Rita, just this weekend, it's been one full
Wow.
year.
Yes.
And Mark and I, we were just calculating it today. I've lost like 63 pounds.
Wow.
Fantastic.
But it's been a lot of effort, and
Mhm.
and I've had so many plateaus during that last year, and it's been frustrating and
That's
tearful.
normal. It's normal.
Oh, I
Mhm.
know, but you think you've hit a brick wall when that happens, and you think,
Mhm.
oh no, I'm a failure. And but I hung in there, and I've made it this far. My goal was to get down to my correct BMI and weight, which is 130 pounds for me because I'm kind of short. And I keep telling people all the time, I'm not too fat, I'm just too short. So anyway, I weighed in this morning at 132 and a half.
Wow.
Yeah,
That's
you got to count that
fantastic.
half. I weighed in at 132 and a half. So I'm almost there, a couple pounds away, 2.5 pounds away from my goal. I'm, for all practical purposes, I've reached my goal because I have my window. My 130 is going to be the low side of my window, and 135 is going to be the high side of my window. So that's going to be my window to be between 130 and 135. And I'm right there at 132 and a half. So I have reached the goal. And
Yeah.
yeah. And
And no
so
longer pre-diabetic, right?
I know my
Wow,
blood
that's
work. Oh, well,
fantastic. Very
Rita
good.
saw my blood work. It all came back like almost all of it was right in the middle of
Wow.
normal, with just a couple of things on, like my bad cholesterol was on the high side, and a couple of liver enzymes were on the low side. Everything else was right smack dab in the middle. And so I told my doctor, I said, well, I've got to get those in the middle. And he goes, Kathy, this is not a competition. And I said, I know, but I want to get him in. I want to get as normal as he said. I wish all my patients had your numbers.
Really.
So it's been a struggle, but health is very important to me. It's the reason I left the salon industry to work on my health. And so it was kind of a rough start. I was thought I was doing all the right stuff, but I wasn't getting the results that I was looking for. And so I started doing a deep dive into some biohacking and things that I could do. And I never really understood the intermittent fasting.
Mhm.
I'd always heard about, but I never really understood it. So I did a deep dive into that, and that works really well for me. And so I just now am a contributing author in a book called Biohacking Entrepreneur. So, and my chapter is all about how I got out of the salon industry with all the chemicals and everything that was going on. And I owned my own gig, Jennifer, so it was hard for me to walk away.
Wow.
I
Yes.
owned 5 salons, and I walked away from all 5 salons
Wow.
because I made my health a priority.
Alrighty. Mhm.
And so anyway, so that's my story, and I am here now as a passive income mentor. I started investing in real estate so that I could retire out of the salon industry, and I am now. I've been out of the salon industry. This starts my 7th year, and yeah, it took me a while to finally catch up with the great health, but I feel like I'm making some traction now, um, and so I can't wait. I go to Florida in April for my third book launch, and this is the Biohacking Entrepreneur. and I'm going to be a keynote speaker for the launch event. And so I'm just excited about everything that's happened in the past few years. And so that's my story for those that are listening to this either live or later on. And I now want to turn it over to Rita for a moment. She is my co-host, my co-mod, and I want her to tell you a little bit about her story and what she brings to the table. And then we're going to get to talk to Jennifer. So over to you, Rita.
Thank you, Kathy. And just, do we have a bio for Jen to read for Jen, or I can
I
just do it
do.
you do? Okay, great. So
I
I'll let
do.
you read that. So I'm Rita Brewer. I've been a clinically practicing physician associate for 33 years, many specialties of medicine and surgery. But about 10, 12 years ago, I became passionate about preventative health and wellness because I was tired of just seeing chronic disease and obesity continue to climb and climb and climb and not make any progress. So actually, that was where I got to meet Jen. I worked when I moved to North Carolina, I started working in a weight loss clinic. And that's where I met Jen. She's also a PA who worked there for a period of time as well. And I got to know her, and she was just a beautiful, beautiful human being and really smart. And we both left there years ago, but we've kept in touch ever since because we love each other. And I currently practice lifestyle obesity medicine, and I have a private health coaching practice where my passion and specialty is helping people reverse their type 2 diabetes and obesity, because this is a condition that is preventable and in most cases reversible. So that is my specialty. And yeah, so I'm another topic that, as a postmenopausal woman has become very interesting to me as a patient. And of course, it's not my specialty, but it's very important for a lot of my patients who need help with hormone replacement therapy. So this is Jennifer's specialty, and I'm excited for us to talk about that today. But let's read her bio so you can have a little bit about her background, and then we'll let her share her personal story and how she got into this specialty.
I love it. Rita, thank you so much. And I am very, very proud to have Rita as my co-host, my co-mod. She brings the other half to the podcast, that the experience and the actual licensures and all of that I don't have. So I have a passion for health, but I don't have the medical background. And so that's why I invited Rita to be here with me. We met on Clubhouse, if you remember. Oh gosh,
Yeah,
how many
yeah,
years ago was that?
yeah.
And
Before that, through Wendy's
that's
Facebook
right.
group, Speakers and
Yeah.
Coaches Facebook group. Yeah.
Yeah. So anyhow, Rita and I go back a few years, and so this has just been a great gig for us to do this podcast and to just make folks aware of all the different health issues and solutions that are out there. So I want to talk about Jennifer. She is a dedicated healthcare professional with over 2 decades of experience in the field. She graduated with honors from Emory University in Atlanta, Georgia in 1999 with a master's in medical science. She specializes in endocrinology and metabolism. She has a passion for patient education, emphasizing the importance of prevention and wellness. Throughout her career, Jennifer has worked closely with individuals to help them achieve optimal health and well-being, particularly in the areas of weight management and metabolic health. Her commitment to compassionate care and empowering her patients has made her a trusted figure in the medical community. Jennifer, thank you so much for being with us.
Thank you.
Give me a little bit of your background journey into this whole healthcare field for you.
I'd be glad to. So I have been a PA for 25 years, and during that time, because I have a son with special needs, I have been in several different fields of as being a physician assistant. I'm afraid I had to work part-time only, and sometimes those were easy to find and sometimes they were not. So I've been in a few different areas of medicine, but about 15 years ago, I hit upon endocrinology, and I wasn't even sure I was going to be interested until I got in and realized this is like being a detective. This is like, okay, this is going on with my patient. This is going on. These are the labs. These are the symptoms they're having. This is what I see with my eyes and feel with my hands. Let's see. What is causing this and what can I do about it? So for me, it became like an exciting detective puzzle solving for the good of the patient. And on top of that, it was much more of a team approach. I had never been in an area of medicine that was as much of a team approach to helping someone feel better. And just like Rita, I noticed traditional endocrinology was a lot about what do we do once things break. But like Rita, I got really interested in, well, what can we do before that, before things break down?
Mm-hmm.
What can we do to prevent? What can we do to make people not feel healthy, but feel vibrant and not just live, but thrive? Um, I started going through perimenopause myself at about 43, age 43, 44. And that's when I found out about bioidentical hormones and bioidentical hormone therapy, or as we call it, BHRT. Bioidentical hormone therapy sounds really big and scary, but it's basically just the hormones that we use in treatment are chemically identical to what the human body makes. So some people call them natural, some people call them bioidentical, but in general, if it doesn't look exactly like the ones your own body makes, it's not bioidentical. So I
Well,
found out, oh, go
how
ahead.
does that how does that differ from like the traditional hormone therapy?
Excellent question. So, traditional hormone therapy that had been around for many, many years, most of that was synthesized chemically. Um,
Okay.
Not that bioidentical isn't seen in a lab, but the medications that were traditional HRT were medicines that either, once they got into the body, either had to be broken into active and inactive ingredients, or they had to be metabolized in some way before they could be used. So the big difference between that and BHRT is once BHRT gets into your system, it is ready to go. And your body sees it as something that, oh, yeah, we
Okay.
recognize this. We know what to do with this. No, we don't have to put it through the liver 3 times before we can use it. And so the risk of a lot of side effects goes down because so many of those side effects came from having to metabolize these artificial chemicals that our body didn't recognize or wasn't familiar with or had to break down into active and inactive ingredients. Um, and the side effects, many, many times, come from having to go through the liver, having to be detoxified and gotten out of the body. And before they get out of the body, they cause some havoc while they're there. But having perimenopause and feeling some of these symptoms that my patients now feel, the hot flashes, the brain fog, the fatigue, um, I get it. I get it. It's miserable. And you don't feel like thriving and you don't feel like yourself. And my goal when I work with patients is to try to take them back a few years and just get them back to themselves, the self when they felt good, when they felt confident, when they felt comfortable, when they felt healthy, when they felt vibrant. And so that's how I found out about it as a patient myself, trained with many different groups. There are some fabulous groups out there, but I trained with A4M, the American Academy of Anti-Aging Medicine. They're one of the absolute leaders in the world with BHRT. I've also trained with a couple of companies that make and compound bioidentical hormones. So I've trained with the compounding pharmacy groups. I've also trained with the compounded pellet groups and many different offices all around the Raleigh, Durham, Sanford area. For the last 15 years, this is all I have done is weight loss and hormone therapy because I found those go hand in hand a lot of the time. And that's how I got into it by being a patient, by experiencing these terrible symptoms, and just not knowing I can feel better than this. This is not how I want to spend the rest of my life.
Well, what I find is oftentimes these symptoms sneak up on you.
Hmm.
Because we're all busy. We've got the jobs and the kids and the laundry and we're just busy.
Right. Doesn't
And
everyone get fatigue?
yeah, so you're
Everybody.
thinking, I've just had a busy week. This is, and it sneaks up on you. And so how do you actually diagnose when the symptoms of fatigue and weight gain? I mean, there can be so many underlying causes.
Yes.
How can you actually diagnose that easy? And what are the common signs that you look for that you go, oh, I bet that's what's going on here?
Gotcha. So one of my favorite mottos is test, don't guess.
Okay, okay.
I love to do testing because, like you said, so many of these symptoms can be subtle. They can look like other things. Female hormone imbalance can look like thyroid imbalance,
Oh,
can
wow.
look like autoimmune disorder, can look like, I mean, there's so many things that are similar that it is very difficult sometimes to differentiate what's going on here. See, we're going back to the detective thing.
Oh, yeah, I see that. Okay, okay.
But I do love testing. I love to do serum testing with the blood. I love to do saliva testing for tissue levels. I love to do urine testing for metabolites. So, depending on what we're looking for, what we're suspicious of, what the patient is struggling with, that can point me in a particular direction to do testing. And then testing will either confirm or go against what we're seeing with the person, because I never depend on a test and a test alone. Um, I really think one of the downfalls in medicine today, we don't look at the whole person. And
Mhm.
shame on us. It's our own fault. We've gotten to where we depend on a lab or a test or one thing here, one thing there. So I try really hard to listen to my patient. When did these symptoms start? What else is going on with that? What was going on in your life when this happened? Um, and what have you tried? What has worked? What has not worked? That plus some lab testing, plus taking my hands and putting them on the patient and seeing what I see. It is amazing to me how many women don't realize they're starting to have some scalp thinning because they can't look at the top of their own head, but I can. Some women don't realize they've lost some of the elasticity in their skin, but again, I can. So I put all of my tools together, testing, my physical exam techniques, my listening ear, my patient's reports on what they're going through and how long it's been going on. And it helps me come up with the culprits and
Yeah.
what the
Can I
problems
move
are.
close to you, by the way? Can I just move over there?
Please.
This is so important. They do say in medicine, they say treat the patient, not the labs.
Not the
Um,
lab.
but however, we do look, the labs are very important. That's why we do them. But like she said, you got to put the whole picture
Okay.
together, not
Yeah.
just one thing or the other.
Yes.
Yeah.
How can
So
you tell who's a good candidate, though? I mean,
Good.
now
Good question.
once you decide, okay, this is what I think is wrong with this patient, and this is what I think the solution is, how do you determine if they're a good candidate?
Well, I want to read something to you if that's okay.
Sure.
mhm.
I want to just throw out some of the functions of one of the hormones that I work with. So I love estrogen. It's my favorite hormone because it does so much for women. But
Mhm.
some of the things that it does to me are just mind blowing. Estrogen is a natural calcium blocker to help keep arteries open and blood flow going to the skin, the joints, the brain.
The heart.
Um, the heart,
Mhm.
absolutely. It helps form neurotransmitters like serotonin, which are important for depression, anxiety. It helps lower cholesterol levels that are bad, raise cholesterol levels that are good, and prevent plaques which all of those things equal healthier heart.
Mhm.
Um, it does miracles with the skin. It decreases your wrinkles, it increases your elasticity, increases the softness, the thickness of the skin, the hair, the nails. It decreases your risk of colon cancer. It increases your energy. It helps you uptake magnesium so you can sleep better. It helps your nerves grow. Um, Helps maintain your memory, your concentration, decreases your risk of Alzheimer's, regulates your blood pressure, improves your insulin sensitivity, Rita, um, increases your libido and your interest in sex, maintains your bone strength, decreases eye disease like macular degeneration and cataracts, and helps maintain your body temperature. So it's hard to find a woman who that wouldn't be helpful for.
I can see that.
Mhm.
You
So
know, I go to the doctor, I do my routine. He's never once mentioned that, and he knows that, I'm almost 70. I went through menopause right on my 50th birthday. So, um, and I've never taken a supplement.
I'm afraid for the longest time we used hormone replacement therapy simply to treat menopause symptoms and nothing else. But as you can see from, just some of those are just a half of the things that estrogen does.
I want all those things. I want all that.
There are so many other benefits to what estrogen can do to keep us healthy and prevent disease that you don't have to just use it around menopause years. So it is possible to have a little bit of estrogen going into your 60s, 70s, 80s. I believe my oldest patient was 78, and
Okay.
her doctors were still flabbergasted at her bone health and her bone density because she had been on estrogen replacement for years with me. So I think the perfect patient is any woman who is no longer making enough of her own hormones, or maybe she's making them, but she's making them out of balance. Because the one thing that I did find, if I can put one word on hormone therapy, whether it's thyroid, adrenal stress hormones, or women's hormones, is balance. It's all about balance. You can't have too much, you can't have too little. You need to be in the sweet spot with all of your hormones. And so as we start heading into menopause, we start having imbalances with what we're making and how much. We also, once we've passed menopause, it's all about balance. It's about keeping things balanced. But there are different goals. My goals for a woman who's 43 and going through perimenopause, my goals with her are going to be different than my goals with my 76-year-old lady who I'm just trying to keep her heart healthy and her bones healthy now.
Mm-hmm. Mm-hmm.
Um, so it's important to all women to stay healthy, have healthy hearts, healthy bones, healthy skin, healthy brains. But depending on what the goal is for treatment, everybody's a little bit different. And that's where it's fun to work together as a team with your patient and say, okay, what's important to you?
Mhm.
And let's charge that first.
Well,
Yeah.
Rita
No,
has a
you go
couple
ahead.
questions, but then I have a question, and again, this is coming from a personal point of view for me. Um, but both of you work in the traditional medicine field. You're both trained in traditional medicine. You see how it's important to have more of that team concept. Can I just go to my primary care physician and say, can I have my levels checked, and should I be taking a supplement, and or is he going to poo poo that?
I wish I could say that you could, and eventually, hopefully, we can. And there are some primary providers that I'm working with more and more and more that I'm seeing more and more come along, and I'm so excited, especially as integrative medicine and functional medicine become more and more important. But in general, classically trained providers do not feel competent and confident in hormone balance therapy. And a lot of the reasons were early research questioned some of the safety for hormone therapy.
Right.
Thank goodness newer research is blowing the doors off that idea.
Look, I
Okay.
want to get into that a little bit more, Jen, because I think that's really important. I remember back in the day when my mom was starting on hormone replacement therapy, and that was back in the day when they did use these synthetic, like you said, non-bioidentical. They're synthetic chemicals. For example, many of you may have remember the name Premarin, and I don't even know if some people still use that or not, Jen. But I didn't realize it comes from. Think about the name pregnant mare urine. So pregnant female horses, they would take the urine and then make the Premarin out of that. And I was like, ew, I don't want my hormones coming from a horse. Love horses, but I don't want it in any of their urine in my body. And I remember my mom just had horrible side effects and breast tenderness and discomfort, and she just stopped her hormone replacement therapy. She could have been somebody who really could have benefited from it because she was a smoker for many years. And then what you were talking about, Jen, it was the World Health Organization came out with this study that said they were unsafe, and I don't know if it was specifically just the estrogen components, or if you could share a little bit about that, what they were saying, and that it really just shut down like the whole industry
It
for decades. So
it
women
did.
did not get the help and support that they needed in this area. So can you share a little bit about that study? And
Absolutely.
yeah.
So, back in 1993, the World Health Organization with the National Institutes of Health, they came out with a study. They said, let's go 10 years forward and follow. They registered 160,000 women. Let's go 10 years forward. Let's put some women on hormones and some women on placebo, and let's follow these women going forward. So they ended up having about 16,000 women on the hormone arm of this study. And either the women took Premarin or Prempro or Provera, all three of which were synthetic forms of estrogen and progesterone. And about 5 years into the study, they came to a screeching halt because they found that the women on hormones, their risk of heart attack, stroke, cancer, fracture, and blood clots was up significantly, 25% higher
Oh.
than everybody else. And so they immediately stopped the study and said, forget it. Hormones are bad.
Mm, mm.
Um, so what we learned from this study, however, there were a few things. The assumption that all hormone forms work the same on the body is not true. The assumption that oral hormones versus topical hormones or hormones by shot work the same is not true. The idea that synthetic hormones that do not look like our natural hormones and bioidentical hormones are the same, not true. So, but because of this study, I'm afraid a lot of doctors, and especially those that were classically trained, meaning typical medical schools, got very nervous about estrogen and progesterone and said, if there's not a serious reason to proceed with hormone therapy, we're just going to leave it off to be safe. But what we have found, and actually what we've known, but finally, thank goodness, enough brilliant minds in Europe and in some of the colleges and universities brought to the forefront, people who were not associated with the pharmaceutical industry brought to the forefront that bioidentical hormones do not do the same things. Topical hormones do not do the same things. And I did not know this even when I started working. I'm a PA. I went to years of school. I did not know this, that we make three forms of estrogen, not one, but three in our lifetime. And all three have different activities. So it's a matter of getting the right kind of hormone in the right form produced the right way.
Goes
And
back to that balance.
it does.
Mhm.
And if you do those three and you balance the hormones, and a good, then that's where the safety lies. And that is what study after study after study after study since 1993 has shown us. And a good way to think of it is if estrogen itself was dangerous, we have the most estrogen when we're young and when we're
Mhm.
pregnant.
Mhm.
And the rates of heart attack, stroke, and cancer are so low when we're young and pregnant. So the connection is not estrogen levels, but it's where are they coming from? How are they being made? And how are we putting them into our bodies? So, yes, that set us back many years. Thank goodness there's enough very well educated, very smart, very vocal providers going around the United States saying, no, 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 please don't leave these women without treatment, without care, without health. Let's replace the natural hormones that they're missing. Let's balance them with the other hormones that their body also used to make and get everything balanced. Keep them healthy, keep their heart healthy, their brain healthy, their skin healthy. So it really has everything to do with what kind of hormone, how it's made, how you're getting it in, as opposed to just all hormones are bad.
Yeah, so that's the good news now that we know and more people are becoming aware of that. However, the frustrating part is still that, um, last episode we talked about functional medicine, Kathy, if anybody wants to go back and listen to that. But this is really a field of functional medicine and anti-aging medicine as well. Because, like when Jennifer was talking about the type of testing that she does, that type of testing is not offered in conventional medical practices. I've talked to so many GYN doctors and patients of mine who are struggling. They're on hormones, but they're not having symptomatic relief. And I was like, well, go back to your GYN and get retested. And they've said, no, we're not going to test. Or I've also had them say, well, we'll just go by your symptoms. We don't need to test. If they do, it's some serum levels, but they don't do, the saliva testing or urine testing. And so that's a frustration that I still deal with all the time. And I'm sure you do as well, Jen. So
Yeah.
this is still out of the conventional realm, but more of a functional medicine or anti-aging medicine subspecialty and more of the cash pay practices. So it's still not really available for everybody, right?
No, that is so
Yeah,
true.
it's
That
frustrating.
that is frustrating. Thank goodness. One of our biggest hurdles is insurance still does not recognize BHRT as a valid, tested form of treatment. So most, not all, but most insurances will not cover BHRT therapy. So I'm afraid it still is in a lot of ways a cash pay system, which is not available for a lot of people. The other thing is providers. There are not a lot of providers that are doing this and doing this well.
Right.
I'm
Takes a lot of
afraid,
training.
yes. And for a little while there, it was real easy for providers to open up a hormone pellet clinic. And that just, I have nightmares at night thinking about some of these because anybody can put the medicine in you, but do they know how much and when to alter it and what to test for? So I'm afraid it is still, the onus is still on patients to find good providers that can do this, do it well, and do it for a reasonable amount. But it's getting better.
Yeah. Now, you talked about a lot of benefits of the hormone. So, are there any side effects with BHRT?
Absolutely. And if anybody tells you there's not, they're lying.
Yeah.
There,
And
there,
is there any patient that are not a good
there's
candidate for that?
There are patients that I am very careful with. Any patient with an estrogen sensitive history of any estrogen sensitive cancer. So, whether that's a female reproductive cancer or a breast cancer, I'm going to be super careful with those patients. There are still hormones that we can use, but estrogen would not be one of them. There are also patients who um, have a lot of other hormonal, well, not even hormonal, a lot of other medical conditions that make it difficult to monitor. In other words, if I changed one thing with my therapy, I wouldn't be able to tell, is it something with my therapy that's causing problems or if it's something else that's causing problems. So again, I'm a little picky about who I um, bring in as a patient, um, but only because I want to do what's best for them, only because I want to take the best care that I can for them. The good news is there's almost always something that we can do to make them feel better. There's almost always some hormone or some area that we can tweak and improve and help patients to thrive. But yes, there are side effects. But I've heard it said, I heard this good phrase, the difference between a medicine and a poison is dose. And I
Mhm.
love that because it still goes back to balance.
Mhm.
Um, if I said hormones they like to be between here and here. If you have too much, you can have problems. If you have too little, you can have problems. So I'm very careful. I like to go low and slow with a lot of my treatments. I like to follow carefully with testing. The things we look for, if estrogen gets too high, you become that cranky type A person that we all know and maybe have been at one point. I won't mention any names, but too much estrogen can cause breast tenderness, vaginal bleeding, irritability, headaches. Um, Too much, say, progesterone can cause bloating, it can cause drowsiness. Too much testosterone can cause irritability, hair loss, voice deepening. So that's why I say you gotta be careful who you're using for your provider because you need somebody that can keep you from here to here. Just throwing medicine at somebody and walking away, that's not okay. That's never okay.
Yeah. So, for our patients who need this type of support in the North Carolina area, of course, we're going to give them all Jennifer's contact information, but we have a big audience outside of North Carolina as well. So, what's a good resource that our community can go to, Jen, to find a qualified practitioner that can help them with this? Like the A4M, do they have a find a provider link on their website?
I think A4M is a great place to start. I'm not 100% sure about a link, but I know the people who answer the phone for them are amazing at finding resources. And if you go on their website, and
What is
I
their website
believe it
again?
is just
A4M.
a4m.com.
Yeah, the number 4, not spelled
A the
out.
number 4m.com.
Mhm. Yeah. Any other
Another
training programs?
fantastic another fantastic group is PCCA. PCCA are compounding pharmacists, and I believe that's also PCCA dot uh-oh, it could be org.
Mhm.
It's either com or org. I'm sorry, ladies. PCCA.com or org. But they are compounding pharmacists that would know who in your area are they working with? Who in your area are they compounding hormones for? So that would be a great place to start.
Yeah, that's great. So speaking of compounding, so for our audience that doesn't know the difference between compounding versus regular prescriptions, can you talk a little bit about that? What is compounding? Uh,
Compounding is beautiful. Compounding is um, one of the things about hormone replacement therapy in the past has been it was one size fits all. Maybe they give you three different strengths, and that you had to choose from one of those three, or maybe four different strengths. The beauty of compounding with a really good compounding pharmacist, they can make your dose exactly what you need. They can figure out what base to put it in to get it into your skin, or to get it into your lozenge, or to get it into your needle or your shot, depending on what form you need. And they can also figure out how to combine two or three medicines together so that you spend less time and less money. So make a good compounding pharmacist your friend.
That's
Good to
awesome.
know. Good to
Yeah.
know. Let's talk a little bit about weight loss. How does the hormones affect? Because we hear this all the time, and you see it on the Facebook thread, and there's always some guru out there saying, you're not, you don't need to exercise more. You just need to get your hormones in line. And how does it affect weight loss or the lack of weight loss for gals that are just struggling with that? I mean,
Absolutely, 100%. So weight is multifactorial. There's so many things that go into your weight and affect your weight, but every hormone just about has the potential to cause you to gain or lose. So if any of your hormones are out of balance, you can see problems. For example, if you do not have enough testosterone in your system, you can't maintain your muscles. And if you have more muscles than you have fat, you have a nice high metabolism. But if you have more fat than you have muscle, your metabolism is going to grind to a halt. And so testosterone and your muscle go very close together. Estrogen, if you have too little, you tend to put on weight around your middle. But if you have too much, you tend to have decreased insulin sensitivity. You start having higher blood sugar, your risk for diabetes goes up. So there we go again. Same thing, we talked about
wow.
progesterone a little bit. If your progesterone is too low, if your progesterone is too high, then you start bloating and water retention and gaining weight that way. If your thyroid hormones are off, they will cause you to gain weight if they're too low. If your adrenal hormones are off and you're constantly under stress, that will cause you to gain weight. So all of these different systems work together or work against each other to cause you to gain weight or even lose weight. If you're one of those people who just can't seem to gain weight and you're trying to, probably a hormone related to that.
Yeah. One of my
Carmela,
think so yeah, so one of the things my teacher taught me too in functional medicine and that I love so much is talked about how every single hormone of the body, and there's many of them, are constantly communicating with each other.
Mhm.
Because when we start going through these things, we feel like our body's betraying us, right? Like, what's wrong with me? But
Yeah.
your body is working, they're constantly communicating and talking to each other and trying to create balance for all of the symptoms that are
Yeah.
going on. So I love that. So we really that's why we have to treat the entire body.
Body, the whole person.
Yeah, yeah. So go ahead,
yeah.
Carmela.
Well,
Carmela
Carmela
had a
is in the
question.
audience, and she said that she does struggle with weight, and she said how. And again, we talked about this early on. I think maybe before Carmela jumped on the call, and she was like, "How do you know? How do you know? When you should take that next step and search out someone like you, Jennifer."
You could absolutely start with your family doctor. Your family doctor is willing to do some basic things to check, like thyroid testing, like you might talk them into an estrogen test just to see. But if your family doctor, your normal provider, is not getting anywhere with your treatment, then it's time to find a specialist that specializes in hormones, that specializes in menopause, that specializes in weight. Um, and go back to that thing that I said in the beginning, we test, don't guess. I can assume, I can look at you, I can have a good idea, but I also need to test to find
Mhm.
out what your levels are. What are we missing? Yeah.
Yeah, I have a question too that came up a lot with some of my patients, wanting to know if at any point in life is it too late to start hormone replacement therapy? Because I've had some people say, well, if you're 10 years past menopause and you've never been on it, then it's too late to start. Like, is that true or not?
Yes and no.
Okay.
If
Explain.
I
Nothing's easy, is it, Jennifer?
yes, the ideal time to start treating menopause symptoms is right before, during perimenopause, or up to 3 years after, for menopause symptoms. But for those benefits that we were talking about earlier, for the
Mhm.
heart benefits, for the bone benefits, it is never too late to do a little bit. Of course, the goals of treatment would be slightly different. The doses would be much smaller. But it's never too late to work on your heart health and your gut health
Mhm.
and your bone health and your brain health and
Mhm.
prevent heart disease and stroke and Alzheimer's.
And there's no age when you should stop either, from what I understand, right? You can continue for the rest of your life if it's helping you.
We have not found, again, we always, and you know this, Rita, we always balance risk benefit.
Right.
If we ever get to a point where it's more risky to continue than it is to benefit the patient, then we would consider stopping at that point. But we haven't found that point yet.
Now, I don't understand, of course, the whole hormone therapy to the extent of this question, but is it something that if they're on a therapy and they do they have to wean off if it's time to stop, or is it something they can just stop?
It is ideal to wean off, because otherwise it's almost like putting yourself through a mini menopause again, and nobody
Okay.
wants to do that. But absolutely. So if we have somebody that can't continue or doesn't want to continue for some reason, it is better to wean down a little bit before coming off completely.
Okay. Okay. And again, I know this is an individual case by case basis, but can you give our listeners just some general idea of costs since this is not picked up by insurance? And I know it makes a difference on the dose and how often and how much, and I understand all that. But again, a lot of folks are thinking it's probably something I can't afford.
So, a couple of things. How you take the hormones has a lot to do with price. There are injectable forms of hormone, there are creams, there are lozenges, there are capsules for progesterone. Um, I tell people go ahead and budget somewhere in the neighborhood of $75 for,
Okay.
for one hormone for a month. Now, you're going to find situations where you can get better deals. Sometimes, if you get more volume, say you get 3 months at a time, but go ahead and keep your idea around $75 per hormone per month. And then it also depends on whether you are seeing someone who has everything rolled into a package where the
Mhm.
testing is included, where the visits with the provider are included, or is everything come separate? So those are things to think about and consider. Usually, your first visit, there's a visit where you sit down with the provider, you get some testing done, you go over that testing, and then you get a plan. And you can find those visits depending on how much testing they do. I have literally heard 150 to $1,000 is the range. So it completely depends on who you're going to, what they're
Okay.
doing. Um,
Yeah.
but you can do some homework and find some people who are reasonable or who are willing to maybe break things up and not necessarily bundle everything together. Or when they do bundle stuff together, it's really worth it because you're getting
Mhm.
so
Mhm.
much for that one price. Do not commit to long-term therapy plans. Don't do it. Don't commit to a year's worth of something and pay somebody $2,500. Don't do that. Don't do that. Just let them prove themselves to you first.
But a monthly plan, if you found one that was a reasonable.
Sure. A
Yeah.
monthly. I'm with a group now. We do 3 months at a time.
Okay.
And I like 3 months because that gives somebody a chance to get on the hormones,
Yes.
for us to tweak the hormones, for us to do some retesting and see where things are. And then about that time, we've gone about 3 months, and they can see, okay, this is really helping me, or oh, this is really not. And they haven't wasted more than 3 months of time to get to that point.
Yeah. And most of those tests and consultation follow-ups are not accepted by insurance. But if you have an HSA plan, like a health savings
Mhm.
account or a flexible spending account, you can get receipts and submit them to your insurance to use for that purpose.
Yes.
Yeah.
Yes.
So put money aside for that.
Yes.
Yes.
Good to know. Good to
Yeah.
know.
Yeah.
And again, your health has to come first, because remember when we started this call, we all have hundreds of problems until our health goes bad, and then we only have one.
That's
And,
right. That's
and we
right.
also talk about paying for your health now or paying for your sickness later.
That's right.
Yes.
That's right. This has been awesome. I love this topic so much, and thank you for clarifying so many things for us, Jen. So tell everybody, how can they find you and work with you? And I just started working with Jen recently as well, because the person I was working with before was not getting me the results that I needed. So I'm excited to, I can't tell you my success yet because we just started, but I'm excited to continue and see how this all goes. But tell everybody, Jen, how they can work with you, and what's the best way to get in touch with you.
So if anyone is having challenges with hormones, or you think you are, or challenges with weight, or both, there's two good ways to get up with me. My personal business is Bridger Health and Wellness, and you can contact me by phone at 919-576-0716,
I
or
lost that. Say the number again.
okay,
919.
919-576-0716. And that is a private voicemail. You can leave me whatever information you want. I'm the only one who'll hear it. Also, if it's easier to shoot me an email, Bridger Health and Wellness, all one word, at gmail.com. Bridger Health and Wellness at gmail.com. That is also private. You can give me any information you want to on that, and I will get up with you.
Thank you so much.
Very good.
Well, I love what you ladies are doing. I appreciate you giving me the chance to talk about my favorite thing in the world. As you could tell, I was up on my soapbox. So, but thank you. It's an honor to meet you both and work with you both.
And I do have one final question. Our audience is outside of your actual area. How wide can you practice?
I like to see patients the first time in person, but I have had many patients who'll come see me in person, and then we can follow up virtually after
Okay.
that.
So it
So,
really doesn't matter where they live, but
so if you can get to Raleigh, Carrie, once, I'll see you.
Okay.
We can work together.
Because
I can do that. He's a pilot and has an airplane, so I can do that.
There you go. There you go.
But your medical license is just North Carolina, right?
Just North
Jen?
Carolina.
Okay,
Yeah.
great.
Okay.
Well, you better
Perfect.
come and see me, Kathy, or stay with, you
I
can stay with
know.
me if you want.
I know. Thank you so much. Rita, thank you for being on. I appreciate you. I can't tell you enough how much I appreciate you. And
My
Jennifer,
pleasure. Back at you.
yeah. And Jennifer, thank you for sharing all of your wisdom. I learned so much today. Again, I'm all about biohacking my health these days, and this was just perfect information to have. And I want to say thanks to Sherry and Shirley and Carmela. Thank you for being with us today and listening in. And Sherry and Shirley are listening. Carmela, you can unmute it. Did you have any comments or question for Jennifer before we go?
I'm gonna have to go back and listen. I'm sorry I'm late. My schedule was thrown off. I was with a bunch of teens last night until this morning at a bowling alley, so my whole sleep schedule was off.
Oh, bless you.
I get it. I get it. Carmela is all their she's the mom. She's the house mother. Takes care of all these kids.
Well,
So
Kathy, I just got added to something else, so I joined another committee. So this is totally different. But one thing I know I am going to have to, follow up and get research, do some research because my doctor, as I mentioned in the chats, we have a love-hate relationship because she'll just say, well, take this and prescribe something. So currently I'm taking like Paxil and Trazodone.
Mm,
Trazodone I hate taking because it knocks me out.
mm,
And the next morning I feel like I'm cotton mouth and that my focus is totally like clouded. So, but I have like gained weight. I notice it when people take pictures and I'm like, oh my God,
mhm.
But I'm trying to, get a handle on my health only because like my mom has dementia now and it's like, okay, where did this come from? It came out of the blue. And as I used to be told by her, your health is the most valuable thing you have. So you need to take care of it while
Good
you
for you.
can. So, but I thank Rita, you guys for having this. And like I said, I'm going to have to go back and listen to it from the beginning because I did come home and took care of a sick husband who has a cold and I slept. So
And share with
little,
all your friends.
yes.
yes. Well, Carmela, thank you for being with us. And I'm going to post the replay, and then I will also send it over to you, Jennifer. And please feel free to use the replay however you wish. If you want to use it on a website or wherever, you're welcome to do that.
Thank
And
you.
Jennifer, as a free gift to you, we're going to put you in our speakers cabinet so that other folks can find you and find what it is that you do. And if they're looking for someone, if they need a speaker for some event or a virtual event such as this, you may get a call or two. So
Thank
hopefully
you very much.
we
Very
can
much.
help spread your message. So that's our goal. The rising tide raises all the ships.
Yes, ma'am.
Thank you everyone for being with us, and we will see everyone next time.
Yay.
Bye
Bye.
bye. Thanks, everyone.